Okay, good evening, everyone. A very warm welcome to all of you joining us from different parts of Africa and beyond. My name is Diane Mumararungu, and I'm very delighted to be your host tonight for this first session with Wildlife Tourism College, our first virtual series. Yes, so as I was saying, tonight's talk is titled Recognize Zoonotic Diseases in the Wildlife, a field guide for wildlife workers. These are the key learning outcomes that we are hoping to achieve by the end of this talk tonight. Zoonosis in wildlife that is going to be given by Dr. Francis Gakuya. And the first learning outcome is to understand the definition, drivers, and the global significance of zoonotic diseases, recognizing pathways of zoonotic diseases, spillover from wildlife to humans, identify strategies used in surveillance, investigation, and control of zoonotic diseases in wildlife. Lastly, demonstrate the role of wildlife and tourism professionals in RA detection, reporting, and as well as education. And now it's my greatest pleasure to introduce you our guest speaker for this session, Dr. Francis Gakuya. Dr. Francis Gakuya is a senior principal scientist and head of wildlife Healthy and Laboratory Department at Wildlife Research and Training Institute in Kenya. He is a wildlife veterinarian, epidemiologist, and a researcher with 25 years experience in research, clinical practice, capture and transmission, and captive wildlife management. He previously worked also as the Chief Veterinary Officer and the Head of Veterinary Services in Kenya Wildlife Service. He holds a bachelor's of veterinary medicine, master's and a PhD in veterinary epidemiology from the University of Nairobi. His research areas of interest are zoonotic and animal diseases at the human-wildlife livestock interface, disease, ecology, and wildlife genetics, and has published 81 papers in peer-reviewed journals and 5 books chapters. So please join me to welcome our guest speaker, Dr. Francis Gakuya, to take the floor and to give us his wisdom. Dr. Francis, you're welcome.
Thank you, Diane, for the introduction.
Okay, Dr. Francis.
Yeah.
Hope you can hear us.
You can hear me?
Yes, clear. We can hear you clearly. You're welcome to start. We can hear you.
Thank you. It seems I'm losing connectivity.
No, we can hear you, no problem. You can
Okay.
switch off the video if you want for us to have a better stability. Okay.
Okay, that's fine. I think it will be more stable without the video. So
yes.
My name is Francis Gakuya. I've been introduced by Diane. I work for Wildlife Research and Training Institute. I'm a wildlife veterinarian and a researcher. So I'll take you through zoonotic diseases in wildlife and their importance. And I'll start off by really an introduction on why zoonotic diseases or diseases generally are important in terms of wildlife diseases. And emerging diseases of wildlife origin are known to cause effects or major effects on wildlife conservation, public health, and livestock production. So disease of wildlife cuts across the 3 areas, that is wildlife conservation, public health, and livestock production. And they have about 4 major effects. One is loss of biodiversity. As you can see on the photo on the upper right-hand side is a rhino that has died. It's a white rhino that has died from anthrax in one of the national parks in Kenya. So you can see a loss of a black rhino, and we lost about 10 black rhinos in an outbreak in 2015 is of major concern to conservationists because such animals are critically endangered or threatened, and therefore is of major importance. And down here, you can see these are buffaloes that are being buried deep so that we control the disease and so that the spores are not exposed. The second one is epidemics and pandemics. Zoonotic diseases of wildlife origin have been known to cause human epidemics and pandemics. And as we move on, we really appreciate some of those diseases. And the third one is outbreak of diseases, wildlife reservoirs or carriers of some pathogens that do not cause signs or clinical signs in wildlife, but they cause signs in livestock, therefore affecting productivity. And obviously, as tourism industry, if there's an outbreak of diseases, people will not really visit such areas, or they will fear, and even there is some elements of potential transmission to humans. And another important thing is that about 3/4 of all emerging human disease outbreaks are zoonotic. Again, zoonotic diseases are becoming increasingly important, and 3/4 or so of diseases that are emerging are usually of zoonotic origin. So what is zoonosis? Really, zoonosis, I think that we have been that question was asked, is an infectious disease that is transmitted between animals and humans. So that is what we call zoonotic diseases. And on the figure on my right-hand side is just a cycle of zoonotic disease. It can come from whichever animal. It can be domestic animal of either mammalian or avian, and then there is wildlife, and then comes to human and vice versa. So you must have all these hosts for it to be called zoonotic disease. And you can see when you look at it on the left-hand side lower, there are very many connections on how these diseases are transmitted between humans, vectors, wild animals, natural communities, livestock, and even the human community. So it's really a major, it cuts across ecosystems. Yeah. And so what drives these diseases? The major drivers of emergence of diseases of wildlife origin are two. One is increasing human population. Okay? And as you can see, the projection is the population is growing virtually across the world, with very significant growth in Asia and Africa. So this really bring humans and animals in more interaction due to that. And with the increase in human and domestic animal livestock populations, then there is increased interaction. So get increased interaction between the two. Again, human population, there is increased demand for proteins with increased domestic animal or livestock numbers. So to ensure that the high demand is met, but there's also increased land use. With more population, you require more human settlements, you require more agricultural land, you require more infrastructure development, and all this leads to more interaction between humans and wild animal hosts. What you are saying is that as the population grows, then there's more increase and more interaction, and therefore there's more emergence of emerging diseases. Another important driver is exploitation of forests. Okay, again, as people exploit forests, and forest resources also mine As you mine, again, you get into more contact with wildlife, with wild species, which most likely humans have not interacted with them for long. Therefore, again, creating another opportunity for pathogen spillover to humans. And also bushmeat. Bushmeat consumption, sale is also gaining momentum, again, due to poverty, requirement for protein and all that. And this actually is one of the direct methods of transmission of zoonotic disease, or what we call zoonotic spillover. And you can see all these cases of bushmeat, okay? These are digs. Okay, this is the logging, and even non-human primates. You can see these are non-human primates that have been poached for meat. So all these will lead to increase in zoonotic transmission or zoonotic spillover. Again, so how does that spillover occur? Spillover occurs from animal host to humans through several methods. One of them is what we call the shared vectors. Remember, vectors transmit diseases or transmit disease pathogen from one animal species to another animal species, such as mosquitoes, sassaflies, sandflies, and so on. So the more these vectors are shared, the more the likelihood of spillover of these zoonotic diseases to humans. There's also what we call the indirect contact, such as exposure. When you get exposed to either rodents or bird species, or even non-human primate feces or urine or other excrements, then there is that likelihood of transmission, especially in the peri-domestic setting, where the humans share environmental habitats with wildlife. Then there's what we call direct, and this is through consumption, animal bites, scratches, body fluid, tissues, and all that. So all these are important pathways of transmission of zoonotic diseases. And zoonotic spillovers from wildlife have been identified as a growing, or the most significant and growing threat to global human health. What we are saying is that in the immediate past, the importance of zoonotic spillover of diseases of wildlife origin has become is one of the most significant threats to global wildlife trade. And you can see some of these include the consumption of bushmeat, which I said is direct. There is the shared vectors, and also there is the indirect, where you get exposed to various other excrements of wildlife. Again, also the zoonotic diseases can directly jump directly from human, not from animals to human, okay? Either from animal species to human directly. And we have some examples there, like HIV, Ebola, Marburg. Or it can be through another animal species, what we call the intermediate species or the amplifier species. So those are two. It can be direct, or there could be another species in between that acts as the bridge hosts. And we'll be able to see examples of some of these diseases. And even in some instances, livestock also can act either as a connector or an amplifier disease. And there is an example like the Nipah virus, where bats have the pathogen, but it's usually amplified in pigs, and then it jumps into humans. So all these are some of the ways that spillover of zoonotic disease happen from animals or from wildlife to human. And some of the important diseases of wildlife origin that have been documented, a lot of you know about the HIV AIDS and its origin in human primates. Ebola, we've had frequent outbreaks, especially in Central Africa. Yeah, the primary host is usually bats, but it's not very clear who are the amplifier hosts. It's thought is either primates or anthropes, and this is an area of importance in research to know if there's an amplifier host between the bats and humans. We have the Middle East respiratory syndrome, or what we call the mask cough, which bats are the primary animal hosts, but camel are the amplifier hosts. We have Marburg. We've had outbreaks in Eastern Africa, where bats are the primary animal host. Monkeypox, there's an ongoing outbreak. Again, it's known the primary hosts are rodents and non-human primates. West Nile virus is another disease, which again, bats are known to be the animal hosts. Yellow fever, which has been reemerging even in Kenya and in Eastern Africa. Again, we have non-human primates are the primary source, and mosquitoes are the vector. And Nipah virus, we have talked about it. There was a recent outbreak in Southeast Asia. Again, it's known the bats are the animal host and pigs are the amplifier hosts. So, and some other diseases, okay? I think I've talked about SARS-CoV, where bats and civets are known to be the amplifier host. We also have the COVID-19, still not determined, but is suspected or known that bats are the primary animal hosts, and then the intermediate hosts are still to be determined. But there's a suspicion that pangolins could have been the amplifier hosts. We have hantavirus, where rodents are the primary hosts, and Nipah virus, avian flu. There's been ongoing outbreaks, especially in Europe, the Americas. Wild birds, especially the shorebirds or the water birds, are the primary hosts, and then poultry are the amplifier hosts. And then the swine flu, there was an outbreak some years back, and pigs are the primary animal hosts, or wild pigs. So all these are important. Again, some other important diseases or zoonotic diseases where wildlife is known to play a role. Really, it might not be the origin, but it plays a major role. The previous ones are direct wildlife hosts, wildlife origin, but these animals play a role. Anthrax, again, which the reservoir is warm-blooded animals. And we've had frequent outbreaks in buffaloes, hippos, zebras, and antelopes. In Eastern Africa, several outbreaks in Kenya, in Uganda, and so on. Brucellosis, wild ruminants in Sweden are also reservoirs. Bovine TB, okay, we have several reservoirs, buffaloes, kudus, lions, and so on. It's a major disease of importance, especially affecting wildlife in the Southern Africa. Plague, there have been several outbreaks. Rodents are the main reservoir. Q fever, where we have wild mammals. I think I've talked about swine flu, rabies, monkeypox. I've talked about that. Rift Valley fever. Wild ruminants have a role to play. It's not very clear, and even trypanosomiasis. So you can see there are varied and many diseases that wild animals have a role to play. So how do we intervene? The intervention is needed to prevent and control spillover of zoonotic diseases. And we use the following interventions. For us to be able to control or prevent these diseases from spillover, we have several interventions. One is disease surveillance, is very important. Disease investigations, disease control, clinical interventions, and research. So these are the methods we use to intervene in terms of diseases of wildlife origin. And we'll go through one by one so that you can see the main issues. And a disease surveillance really is, I will not go to the detail, but there's a continuous systematic process of collecting, analyzing, interpreting, and disseminating health data to identify and control diseases. And it serves several things. One, it serves as an early warning system for outbreaks, okay, including diseases that can affect humans. You also monitor threats. You ensure health wildlife population and reduce cost of managing outbreaks. You inform public health interventions and also inform animal health interventions. So as you do disease surveillance, you are able to achieve those 5 outcomes. One is an early warning system, monitoring the trends, ensuring health populations and reducing cost of managing outbreaks, inform public health interventions, and also inform animal health interventions. And disease surveillance in wildlife is either passive or active. So it's very important to understand that it can be both, and we'll be able to quickly define what these two are. And here you can see this is ongoing disease surveillance. It was avian influenza in the height of the outbreak a number of years ago, but it's usually continuous. It goes on. So passive surveillance really is the one that we mostly use because it's opportunistic and you do it every other day. As you are doing various other interventions, you collect samples, you take clinical diagnosis or clinical parameters and so on, postmortems and so on. So this is the one that we mostly use, but also active surveillance is also used, especially when there is what we call mortality, morbidity events, is death and all that. It's also done when you are doing design studies in research, and also where you have some samples that you can analyze. So these are some of the disease surveillance methods that we use. And you can see, for example, this can be passive surveillance. You can see this is syndromic here. This giraffe on the left side has some skin infections on the around the lips and the nostrils. So definitely I can tell you there's a problem. And this active disease surveillance, okay, capturing some non-human primates. This is a baboon, which is being, samples are being taken for disease surveillance. The other important thing is disease investigations. Again, it's done when there are signs of diseases, such as when there is mass die-offs, okay, or animals have been observed to have some syndromes that are, or some symptoms that are not normal, and also when doing clinical examinations, postmortems, and all that. And you can see staff working on some of the animals. You can see this animal is a skin condition. It's being treated at the same time samples are being collected. Another animal here, this is a cheetah. This the upper one is a lion, and also postmortem is being done. So all these are done to investigate diseases. The other important control intervention is what we call disease control. And this aims at preventing and managing diseases that affect wild animals. So the purpose of disease control is to prevent or manage, okay, animals so that the disease does not spread. And it's usually has a combination of strategies. One is what we call preventive measures. For example, you quarantine animal, you put them in secluded areas so that you can be able to observe them for long. You can also restrict movements. If there is an outbreak of a disease and you are moving animals from one area to the next or to another, then you have to stop or you quarantine those animals first so that you take them through tests to ensure that as you move them. Vector control is also important. Population management is done, but again, sometimes it's not very clear if it really its outcome. Treatment of individual animals, and most importantly is wherever there's an outbreak, proper carcass disposal or disposal of dead animals is very important, and then the disinfection of sites. And you can see during that outbreak that I was talking about, this is a rhino, okay? It has been vaccinated. It's not very clear, but somebody can see a dart. We usually use what we call drop off darts. You dart the animal with the vaccine, and the dart drops off. And this is what we are calling proper disposal. You have to dispose them properly so that you are able to control disease spread and also disinfection. You can see this carcass is being disinfected before it's buried, and then you disinfect the area to ensure that the animal, the pathogen is not transmitted to the next species. So the other thing is clinical interventions, and this mostly involves medical treatments where you treat animals that are infected. It's often challenging in the wild. Okay, and then it's mostly diseases are observed in the wild that need the treatment, and the intended is really to take care of animal welfare and also prevent spread of the disease to other wildlife and spill over to domestic animals. So clinical interventions undergoes every other day, although they are mostly on animal welfare issues, targeting human inflicted injuries, but when diseases arise, they're also treated. You can see on my right-hand side, up on the upper right-hand side, that photo is some of our veterinary team relieving a dystocia from a giraffe. These are wild. It's a free-ranging giraffe that had a difficult birth, and it had to be relieved. And you can see the curve is there. Again, this is a team working on a rhino that has a filari or woods. The same, you can see some woods on the next one. And even, this is in captive facility, semi-captive facility, and you can see that prolapse there being managed. So all these are some of the interventions that we do, again, to prevent zoonotic disease spillover as well as animal welfare. Again, it's not moving.
It is moving. I think your connection might just be a little bit delayed, Dr. Francis.
Okay.
Are you on the slide that you need to be on now?
Yes.
Okay.
Again, another important intervention that we do is on is disease reporting, and this is where it's very, very important for wildlife conservation practitioners, where, can you go back? This is important. We talked about also research is very important because you understand the epidemiology and transmission of dynamics of zoonotic diseases, because you have to be ahead of time so that you can understand these dynamics. If you recall, when I was taking you quite a number of diseases, the role of wildlife is not well known. So a lot of work is required in that area. And also research is very important, especially in discovery of what we call potential zoonotic pathogens. You can be able to pick a pathogen when it's still in wildlife and it has not spilled over or jumped to humans. Okay, again, I said I talked about this disease reporting, very important, especially by wildlife managers, tour guides, hoteliers. They are the first line reporters. Whenever they are there, once they see any syndrome or any disease symptom, then they quickly report to the veterinary authorities or the park management or any other administrative offices of government. And you can see some animals. This is mass deaths of some birds. Okay, these are lesions in the mouth and the nose areas of one of the vervet monkey, some skin conditions in buffaloes, and death of rhinos. All these are reportable to the veterinary authorities. So what I was saying is that disease reporting really is very important, and these are some of the syndromes that we look for, and most of them, I will not go into details. You can see deaths, you can see skin lesions, growths, diarrheas, and so on. So these are some of them that you look at, and you can see some animals like this one is already dead. Okay, skin lesion in this elad, and these are things that you can be able to report including this big growth. I think this must be a hygroma in a giraffe. So these are what you find, some deaths, some animals that, again, you can see some cases of difficult calving, or what you call dystocia, of a buffalo here, of a giraffe. And these are things that can be reported. Again, growths, you can see these are mostly a papilloma, okay, caused by papillomavirus, and quite a number of words here on these antelopes. All these can be, again, okay, these are mostly cases of nervous diseases like rabies. You can see that you never see these unless there's aggression between the species. But when you see it once human, this is now what we call lack of fear and aggressiveness. You can see this animal had actually gone into people's in communities, and even was killed there. Again, some syndromes, you can see diarrhea in this baboon, and even in this cow of buffalo. So all these are some of the syndromes that can be reported. So what are the other roles that can be played by wildlife and tourism professionals? One is education and awareness. This is very important because these are the professionals who have a lot of link with the tourists, with the communities, with everybody, and they can become very good ambassadors to preach the risks of transmission of diseases, so that they avoid a lot of contact with wildlife, and also bushmeat or trade. And the other important thing is good to ensure what you call adequate biosecurity, because as you move in and out of wildlife areas, you can carry pathogens either in or out. So things like disinfection of vehicles, wheels is very important. And also discourage petting of animals. It's very common in captive wildlife. It's always discouraged because of that high probability of transmission of pathogens. Again, animals should not crowd a lot, because as animals crowd, they are stressed, it affects their immunity, and then that would be not the animals but humans. A lot of human crowding then stress the animals, and then can be source of stress and eventual opportunistic pathogens arise, and also reporting any cases to either veterinary or public health authorities. All these are very important to ensure that wildlife or tourism professionals really assist. Okay, I will stop there, and I'm very sorry for the connectivity. I'm not sure what's happening around, but I believe I've delivered my point, and now is questions. Hopefully I'll cover what probably I've lost in between the challenges of connectivity.
Yes, thank you, Dr. Francis. And we totally understand internet stability can be really a challenge. This is what happens with virtual events and classrooms. This is part of the challenges, but I'm glad we're able to conquer it. Thank you so much, Dr. Francis and Marit, for the great support. Now we are into the session of Q&A. The lots of people is in the room, feel free to raise your hand. But in the meantime, I'm gonna ask his question. I'm gonna ask another question from Jackson Ikele, who asked about what are some activities in our communities that may expose people to zoonotic diseases.
Okay, yeah. There are several activities that really can bring that. Obviously, one of them is getting in contact with wild animals, either uh, through hunting for bushmeat, or for trophies, or for skin. The other one is also getting into contact. Probably you get an animal that is dead, and either you want to carry it home, or you will just hold it with your bare hands. That's another important way. Another one also is really going deep into forests for resources, either it's firewood or whatever else deep in wildlife areas. That also is another way, because there you get into contact with vectors and several others that have been interacting with wildlife. So those are some of the the areas that I quickly thought about. And also the other important thing is sharing resources, especially water bodies or water resources with all the animals. When they congregate there, that's a very good platform for transmission of diseases, both animal and zoonotic diseases. I hope I've answered that question.
Yes, you have answered. And the next question is from Matthew Sapi. I don't know if you can unmute yourself and ask your question.
I'm asking how can the local community contribute to the early detection of zoonotic diseases, especially the people that live within the park that don't know anything about how to handle certain diseases.
Okay, thank you. Yes, communities are very important as the frontline reporters of diseases because they'll definitely be able to identify a normal from an ill or an animal that is affected. So one of the ways is really to report, or what we call syndromic surveillance or syndromic reporting. Then you report to the nearest veterinary office, the nearest wildlife officer, or even any other office of government that can take care of that. So that is very, very important for the communities. And if there is any deaths of wildlife or anything that I find, I think reporting is the most important thing. And as I say, the other thing is also not really having very direct contact with wildlife. You just keep distance, and definitely in that way you'll be able to assist in early detection of diseases, especially the reporting itself.
The next question is from Walter Ogwai, who they asked, what are do's and don'ts of animal rescuing? Assume you come across a juvenile wildlife species and you are far away from the expert.
Yes, obviously the do's and don'ts is avoid direct contact as much as possible. If you have gloves, they are the first line of protection. If you don't have gloves, you can use anything, any nylon material that the excrete, whatever the excrements or body fluids of that animal will not touch you, because most of the diseases are actually transmitted through body fluids. So that is very important. And also the other one is you can also put masks, because also breathing in all that pathogen is also another way. So the most important thing is what we call biosafety. Ensure that you don't get into contact a lot of high contact with the animals. You prevent yourself from that.
I saw a hand of Victor from Jalab
Another
Center.
question?
Yes, I saw Victor. He raised his question from Jalab Center. If he can mute himself and ask the question.
Hello, everyone. Can you hear me?
Yes, we can hear you.
I think I just wanted to add something on the question about the community. I think the empowerment has to come in for them to know the do's and the don'ts. Because I want to believe that they're the closest people who live with the wildlife. And some communities, probably giving example, because now we're in social media, all of us have seen the Hadzabe community in Tanzania, which are hunting baboons and eating them literally. And even visitors have been going there, tourists have been going there to see how their life is. And even people have been testing the meat of these monkeys and the baboons. But I think the first thing that need to come out is empowerment. Beside empowerment, because even if we have to empower them at their own level, another thing that I thought of Sorry. Probably I can pass the mic to somebody else.
Okay, thank you. Thank you, Victor. Now, another question. Thank you for your contribution. And I'm moving on to another question is Jackson Yakene asked about what role do climate change and environment destruction play in the lives of zoonotic diseases?
Okay, yeah. One of the things that climate change plays is with frequent droughts, frequent floodings, and so on, they bring animals closer to human settlements or to human, because either if there's drought, there's limited source of resources, water, grazing, and so on. So there's increased interaction. Okay, and the same when you destroy the environment, the same when you do infrastructure development, settlements, and so on, they bring human and animal and wild animals closer, and even domestic animals. And that is a very important transmission pathway. So though the climate change is really very, very, very important when it comes to that. And if you look at most of the diseases, usually outbreaks occur during the dry period, and because that's when, and again, this is when there's a lot of interaction, human, livestock, wildlife interaction. Yeah.
Thank you, thank you. Now we have another question from Brian Musalo, asked about how can you enhance a community-based One Healthy approach to public health and zoonosis management at the human wildlife livestock interface. Yeah.
So what I was saying is that community is very, very important in terms of reporting of diseases. I say that. There's also what we call the citizen science. These communities have lived with these animals for a very long time, and that applies very well when it comes to surveillance or epidemiology of diseases. So yes, community plays a role, and our focus now is really using either communities or even rangers or scouts to report diseases or to report syndromes, and then the animal health professionals come in to investigate.
Okay, now let me move on to Deacon Ali, who also asked about that in the presentation, they have seen birds being a primary host for some diseases, and sometimes you come across a single dead bird. How can someone be able to know if the bird is dead due to the diseases or normal death?
Okay, yeah, it's not very easy really to detect or know that what has caused the death. But generally, if you find if the bird has any fluids that are coming from in somewhere in any of the openings, either the mouth or the nostrils or the cloaca or whatever, then that is a quick you can quickly know that it could be carrying a disease, or it has some wounds or something on the body. But the best thing is you pick it, put with a nylon paper, put it in nylon paper, and then take it to the next veterinary office. That will be the most important. Then the feedback will come back in the problem once a postmortem and laboratory tests are done.
Okay. Let me ask Abigail Sulumu to unmute himself. I see your hand raised. Please unmute yourself and ask your question. Abigail, if not, I'm gonna read your question. He asked, now there are issues reporting. How can I be able to know the dangerous animals like lions and suffering from diseases like rabies, and it is hard to approach. How can I be able to know the dangerous animals like lions who are suffering from diseases like rabies, and it is hard to approach? I think he's looking for advice.
One is possible, although you don't come very close to it. You can you can be able to see an animal that has some wounds or some skin infection. You know, animals are usually very calm. If you find an animal that's a bit aggressive, they could be having something, especially if you don't come very close to it. So there is a way of detecting that, especially when you are used to seeing them. You can see an animal that is not behaving. So it's possible. Yep.
And we have another question from Victor, and was asking, as a bird, how do we handle birds during ringing sessions? I don't know if the question is clear, but he's asking, how do we handle birds during ringing sessions?
Yeah, it's good. You have what the bio safety measures. Okay, you handle them with gloves and all, so that you prevent as much as possible to have contact. A mask is also good when you're handling such animals. The most important is just ensuring that you secure yourself from any disease agents or pathogen that can pass from the animal to you or vice versa. So biosafety is very, very important.
Thank you. Thank you. There's another question from Matthew, and was asking, what are the ethical implications of carrying wildlife, and how should decision be made under uncertainties?
Yeah. Okay. As I said during the presentation, uncertainty. If carrying really prevents spread of disease. Animals in a certain area, especially if they are free ranging, they move away and probably even spread diseases where you didn't anticipate to spread them. But probably in fenced areas or in semi-captive areas, if the population is very high, of pathogens within it, you can reduce the way they're carrying or moving them. But this is not something that is very practical in our life. Especially what we call the stamping out is a disease that has been reported for the first time in a certain area. You can stamp out or remove those animals. Not very, very, very practical. Unless in a, yes, are we?
Yeah, we are still together, Dr. Francis. We can hear you.
Yes, it can only occur in very, very controlled areas, but not in the free range. I'm not sure anywhere. But again, I remember most of the wild animals are usually borrowed from domestic animals. So you can modify them to suit a certain condition, but it's not something that we do normally. Culling usually is done because of either overpopulation of a certain species that is probably, but in disease control, I'm not sure of any study case, especially in free range, that it has worked, but is a probable method depending.
Okay. Thank you. Can Kointoi Eric unmute his microphone? Eric, I think you should try and repeat your question again.
Okay, am I clear now?
Yes.
Yes.
All right, thank you. So, Dr. Ari, my question is, how severe is the infection in humans, animals, or both? Could there be maybe a category that are being affected, like let's say children, adult people? And my second question is, what are probably the environmental factors that you can probably mention about that they are the ones that could be contribute to human behaviors that enhance spill of risks?
In terms of categories, I would think there's any specific category of or age of humans that are affected by diseases of wildlife origin. It also depends really on the pathogen or the age. There are some that could be or immunosuppressed adults and so on. So I'm not sure there's a category that you can say is more. Yes. I cannot say there is a category that is more prone. But again, I remember when you most of the conservation is with, and obviously the age that usually takes animals for watering are mostly the youth. So definitely they are the ones that are mostly closer to wildlife than the rest. So there are those dynamics, but I'm not. I cannot say with certainty there is an age that is preferred. Environmental factors, I say I talked about them, and they actually again arise from increased contact. As I said, when people go deep, it's just either to look for resources, firewood, to look for honey, to look for all those natural resources in there. They get into more contact with wildlife and their vectors than when they live in the periphery of the wildlife area. So I think those are some of the environmental factors. But again, I talked about droughts. I talked about sharing resources, especially water resources, and so on and so forth. Yeah.
Thank you, everyone. I'm gonna have to end this right now because we are over time. And I want to read one more last question from Simon Ganga as we close, who asked about if there is any plan to curb most dangerous zoonotic diseases by any means, like vaccination that can be done by building water dam, reservoir, and add the vaccine in them. I think his question is around if there is an introduction to vaccines.
Okay.
Yes.
Vaccination does happen, and it can happen. But again, is another area that requires a lot of balance, because you again don't foreign material into free-ranging wildlife. Remember, we want the wildlife to live as free-range as possible. So mass vaccinations is a problem. We only go for vaccination for critically endangered species for a specific disease if there's an outbreak. But what we do nowadays is that spread from some of the zoonotic diseases, mostly from animals. So we do what we call indirect vaccination. We vaccinate domestic animals in the vicinity or in the areas bordering wildlife areas so that there's no spillover. And a good example is rabies. Rabies, we continuously vaccinate domestic dogs within the periphery of the park or the boundaries of the national parks and reserves and protect. There's a buffer of spillover of this disease to wildlife. So yes, it can either be indirect, doing it or in wildlife, but controlled if it's very specific during an outbreak.
But I feel like I want to give a chance to Eric, a few seconds for you to ask your question. Be strict on point as we close. Eric, your last question.
All right, thank you so much. Dr. I have got a concern on the disease. There's a virus that's being transmitted by wildebeest to livestock. And this is strictly happening in these landscapes, especially where farmers have got cows. And this disease is known as malignant catarrh fever, MCF. And it's been bringing a big challenge, especially when it reaches to the breeding seasons for wildebeest. And a number of cows has been reported dying because of the disease. Could there be, Dr. To some point, you guys doing research on how you're gonna find the vaccine? It will really helps, a number of farmers who are, coexisting with these species. Thank you.
Yeah, thank you, Eric. Yes, malignant catarrh fever is an important disease. It's a disease of livestock, specifically cattle. Usually, and it happens, the transmission is usually during breeding because the virus is within the placenta or the placenta droppings. Yes, obviously, for practical way is to separate cattle from wild beasts during the calving season. But there's a lot of work that has been ongoing. There is a vaccine still it's still quite far from getting into the market, but a lot is being done on that area. I know of a number of scientists who are involved. Most likely, at some point, a vaccine will be developed.
Thank you so much, Dr. Francis, and thank you, Eric, for a wonderful question. So now this is the end towards our session, and I want to remind you that tomorrow we have a continuity of this series on zoonotic diseases, and we are going to be having Dr. Khadija Juma, who is going to take us through case studies and trace on zoonotic diseases in wildlife. So I want to kindly remind you and invite you as well to join us tomorrow again, same time. So we can keep learning more about zoonotic diseases and case studies that have been in existence in Kenya. Thank you everyone for joining us. It was wonderful to have you all.